So today's examination will be a foot and ankle examination. So this is the steps or the procedures how we can do a foot and ankle examination in exam settings. So as you all know, when we get into the exam, we will find a doorway information speaking about the brief history of the patient, that your patient is having a foot and ankle issue and you need to examine them. So usually we start our examination. I'll just give a small hint about the examination of foot and ankle and hand and wrist before we start. So every examination, when you do an examination of the knee, shoulder, so you're going to examine according to a scenario. For example, if the shoulder is dislocating, so you're going to examine for instability. But for the hand and wrist, they rarely give you, they will rarely give you any scenario. They will ask you to examine the foot. In the examination of the foot or the wrist, you need to see the deformity and examine accordingly. And if you see a flat foot deformity, so you need to examine for a flat foot. If you see a bis cavus deformity, then you need to examine for a bis cavus. You don't need to do the whole examination for every foot. And the same for the hand. If the hand has a significant deformity like a rheumatoid, you need to examine rheumatoid hand, and vice versa. So the examination today, we'll try to do all examination parts, but you need really to focus according to the deformity. So focus your examination according to what you see, not what you read. So I can read here in the doorway information that the patient is having a foot pain. Would you please examine the patient foot? So I knock the door. السلام عليكم، كيف حالك؟ أستاذ أمجد، أنا الدكتور عصام المحريق، ممتحن للبورد أو للزمالة. ممكن تسمح لي نفحص القدم؟ تمام. I'll wash my hand. تمام. سيد أمجد، في أي مكان في جسمك يألمك؟ القدم. تقدر تمشي وتتحرك. تمام. I can see that the patient is sitting comfortable in the chair. He doesn't look in pain and he doesn't look distressed. Okay, I would like to get the patient exposed to the underwear. Very important to ask for the exposure. Before I start my examination, and it's a very common trick by the examiners, they take the patient's shoes and they hide it. Okay, so your first question was, ممكن نشوف حذائك لو سمحت. Can I examine your shoes? Okay, so I can't see your shoes. Where's your shoes? So that's your shoes. I hold the shoes with my hand. Okay, look at them. Examine them, so there's no insets inside, there's no show lift. I can see symmetrical wear pattern in both feet. This is very important that you need to describe. Okay? So I get the shoes back. تمام. سيد أمجد، من بعد ذلك نبيك بس توقف شوية. تمشي قدام وترجع. So I have to look at the patient gait. ممكن ترجع بسرعة. So the patient is having painless symmetrical 3 rockers. So the 3 rockers are symmetrical without any pain. If the patient is having some painful issues while he's stepping, like for example he has short stance gait, you need to think about any arthritis. Okay? If the patient is having a rocker bottom gait, so you need to think about a deformity. Then, after you examine the patient's gait, you ask the patient to come back in front. تمام. Then you need to start inspection. In the foot and ankle inspection starts from the shoulders, back, and foot and ankle. So when I look at the shoulders, I can see the patient is standing still. Both shoulders are symmetrical. I have to look at in the back. So I'm supposed that the patient is exposed. So I can't see any obvious spinal deformity. I can't see any hairy patches or any signs of spinal bifida or previous spinal surgeries. Okay? Then I have to come back and look at both feet. So you need to kneel down to look at the feet while the patient is standing. So I can see that the patient from the front, I can look at both feet and ankles and lower leg. I can't see any swelling, any deformity. I can't appreciate any significant deformity, sinus. I can't see any signs of any previous scars. Okay, this is from the front. I can look at all the toes, they are symmetrical. I can see some nail changes, especially in the big toe or the left side. Then I look from the side. So from the side, I can see the patient is maintaining his heel arch. His weight is equally distributed on the heel and the front and the forefoot. the arch is maintained. تمام. You either rotate around the patient, and if you don't have enough room, so ممكن لو سمحت لو سمحت أمجد. So I'm looking from the back. I can see that the patient is having 5 degrees of heel bulgus bilaterally. Okay, and very important to say that the patient doesn't have too many toe sign. It's very important to mention that. So too many toe sign is negative in this patient. Okay, so suppose here you need to do one of those 2 tests. If your heels were in bulgus, okay, then you have to, after you finish your inspection, you have to do heel rise test. If the heels are in varus, you need to do Coleman block test. So I finished my exam and inspection. I will do the inspection from this side again. So looking from the heel from here, I can't see any scars, any deformities. Patient's maintaining his arch on the right foot as well, and the inspection is symmetrical to what I'm seeing from the other side. Okay, since both feet are in bulgus, okay, you need to examine, to instruct your patients what to do exactly. سيد أمين من بعد إنك عندك تجي على الحيط بالطريقة هذه وتوقف عليه صوابع رجليك وفوق. تمام؟ Okay. خلي بالك شوية. So you need to keep your patient standing on 4 feet for a while. Some of those patients, they have weakness that takes time to appear. So the patient is able to do bilateral heel rise test. تمام. سيد أمين من بعد إنك ممكن تاخذ رجلك واحدة من الرجلين تلفها التالي وتوقف عليه صوابع واحدة من الرجلين بس. Okay. So the patient is able to do single hair rise on the left side. ممكن تدير نفس الشيء في الرجال اليمين. Excellent. So the patient is able to do a single hair rise on the other side. So suppose that your patient heel was in varus, then you need then you need to do a Coleman block test. So for the Coleman block test, so what you need to do, انت مش مفروض انه يكون معك موجود مش مفروض يكون موجود معك الكولمان بلوك، لكن مرات يكون موفرين في الاكزامينيشن سيتنج. فالكولمان بلوك تيست هو عباره عن كولمان بلوك يعني اطار خشبي صغير، تمام؟ that you need to do لو كانت الهيل امبارس ممكن ترفع الجهه الثانيه. that you need to do it on the lateral side. ممكن ترفع رجلك بالطريقه هذه. اي نزل رجلك اول نزلها. of the heel. And you look for the varus, is it correctable or not? Is it forefoot driven or hind foot driven? تمام? If it is hind foot driven, then it will be corrected. If it's forefoot driven, no, it will not be correct. تمام? This is the Coleman block test. You don't need to do a Coleman block test unless your heel was a varus or it was in significant cavus deformity. Okay? So we're done with that examination while the patient is standing. ممكن أخذت ترتاح على الكرسي. So your patients either to be provided to you on a trolley or on a chair. So you need to know how do you position your patients every time. So if he's in trolley, that would be easy because he would be higher up sitting and you can take his leg. If he's on chair and you're supposed to examine him while you're in chair, so most of the time try to compare, but say that we're examining the right foot. ممكن لو سمحت تعطيني رجلك. تمام. I would complete my inspection by looking at the heel, looking for any scars, any deformities, any hyperkeratosis. I have also to look between the toes for any infection or hyperkeratosis. This is very important to examine. Then I would go further into the palpation part or feel part. So the feel part, the first important thing that you need to feel is the temperature, especially in sharp fit. You need to examine it and feel it on different planes of the foot. Okay? Distal pulse, don't forget it because it's very important before you start and it's the most commonly forgotten part. Okay, and start your examination systematically. So I would start from the medial malleolus. I would look at the patient's face, I would feel posterior to the medial malleolus, looking for any tenderness at posterior tibial tendon, tip of medial malleolus. Okay, notch of Harting, tip and flexor digitorum, Brunius tertius, flexor hallucis, and Brunius tertius, Okay? Then, at this point, you need to examine for the synovium. So, just do tenderness at the softest spot of the ankle joint if there is any pain with the patient. So try to do it while the ankle is plantar flexed and push on the synovium, then do dorsiflexion. If the patient has any pain, so that's positive for ankle impingement. Okay? Then feel for anterior inferior talofibular ligament. If there is any pain at this moment, so you need to direct your special test according to the pain. If there is any pain, what are you going to do? Do squeeze test for the syndesmosis and lateral external rotation test. And look at the patient face for any pain. That's negative, so I've examined the syndesmosis and I finished it. Then I have to feel for the tip of the lateral malleolus, brunei, okay, looking for any pain. At this point, since I'm examining the brunei longus and brevis, I have also to examine for any subluxation. For that, what I'm going to do, سيد أمجد رجلك بالوضعية هذه تمام while the foot is plantar flexed and inverted, go from plantar flexion and inversion to dorsiflexion and inversion. ممكن تدير الحركة هذه and look at brunei. They're not subluxating, so there's no brunei tendon instability. تمام. تاخذ الرجل بس ترفعها فوق. You complete your examination by examining the brunei. Then you examine for the Achilles tendon, look for incongruity, feel for palpate at the tip of the calcaneus, looking for any haggling deformity or pain at the haggling part. Okay? Since I'm examining here, I'm examining the Achilles tendon, so it's better to finish the Achilles tendon test. So what I'm going to do, I'm going to do a silver coil test. So I'm doing dorsiflexion, and while the knee is extended, then while the knee is flexed. There's no significant change in the dorsiflexion. This is negative for silver coil. Okay? Now, I would go down, so I would examine for the calcaneus. I would do squeeze test for the calcaneus, looking for any stress fractures. Okay? Then I would palpate at the original plantar fascia, looking for any plantar fasciitis. Okay? Then I would do the windlass. This is the windlass. I do dorsiflexion of the big toe, looking at the arch getting tensioning. This is the windlass mechanism. Then I will examine for the chopper joint. Okay. Then this flank joint. Okay. Then I would feel for first metatarsal hypermobility. Okay. Then I would feel the metatarsals. I would do grinding test for hallux rigiditas and dorsiflexion, looking for any pain with dorsiflexion. Then I feel the metatarsal heads. I can feel some hyperkeratosis at the base of the big toe. Then the interphalangeal joints. Okay. Since I'm here, so to avoid it, not to forget the motor neuroma, so you need to do modular click. What's modular click? Modular click, this is examination when you hold the metatarsals, squeeze them all together, and feel between the second and third and fourth and fifth. Just do clicking, modular click test. This is for motor neuroma. Do it with multiple metatarsal planes. If you feel any click, this is positive for motor neuroma. Okay? So I'm done with the feel part. So after the feel part, I will do the move part. So the move parts, I have certain movements that I have to do. So when you move the ankle joint, you need all the time to use your hand and your forearm. Okay? Hold it like that. This is the way that you hold it. Okay? Do flexion, and you need to estimate the degree. Give them a degree like 40 degrees. Then do plantar flexion, 60 degrees. Okay? I'm done with the ankle joint. Then I have to go to the subtalar joint. Subtalar joint, I have to use my pencil grip to hold the talus, and I have to stabilize the ankle and do inversion and eversion this way. After that, the next movement is the chopper joint. So what's the movement in chopper joint? Chopper joint, supination and pronation. I hold it like that. I supinate and I pronate. Then the next will be the this frank joint. I go dorsal, distal a bit, this frank, adduction, abduction. They will be very tight movements. Then you complete the movement of the hallux and the other toes. Okay? I'm done with the move part. Okay? Now I have to go to the special test. For the special test, I have to do a special test that's commonly forgotten, which is first of them the sensation of the foot. First of all, أخ أمجد بعد إنك هنقول لك الإحساس هذا حاسس صبعي صح؟ نبيك تقول لي إذا حاسس نفس الإحساس تحت أو تمام. Okay? So حاسس نفس هنا نفس الإحساس فوق تمام. This is superficial peroneal nerve. هنا deep peroneal nerve. Okay? هنا نفس الإحساس. This is saphenous nerve. هنا نفس الإحساس. This is sural nerve. تمام. هنا this is medial plantar nerve. هذا نفس الإحساس. تمام. This is lateral plantar nerve. Then at the heel, this is medial calcaneal branch of the tibial nerve. Okay? At the كملنا, this is the sensation, which is important. Next, after the sensation, the commonly forgotten parts is tendon power. You have 4 tendons that you need to examine all the time. أول tendon محتاج دي له examination اللي هو tib post. tib post. تاخذ لو سمحت شوف صبعي، جيب صبع رجلك عند صبعي. خليه يدير inversion وبلانتر فليكشن. تمام. خليك حافظ بالوضعية هذه ما تحركهاش. تحركهاش. Then try to resist ما تقاوم. تمام. باور 5/5 or tib post. تمام. الثاني عشان نفس الدايركشن اللي هو تب اند. خد ايدك رجلك فوق لو سمحت وبالطريقه هذه قومني ما تخلينيش انزلها تخليها some inversion with dorsiflexion باور 5/5 تمام. جيب لي رجلك بالوضعيه هذه inversion وبلانتر فليكشن. This is برونيس وات لونجس. قومني ما تخلينيش تحركها. This is برونيس لونجس 5/5. خلي رجلك بالطريقه هذه واذا تلف بالطريقه برا قومني هذه برونيس بريفس. تمام. That's okay. تمام. كملنا الاكزامينيشن of the nerves. كملنا الاكزامينيشن of the tendons. كملنا الاكزامينيشن of the Achilles tendon, silver coil test, syndesmosis, we all examined. تمام. قاعد عندنا شو ثاني؟
توماس تيست. توماس.
الثومسون تيست. Thompson test. انت Thompson test الاكيلس was really incongruity. لو انك اكيلس كان عندك gap, you can do the Thompson test. تمام؟ better to do it while the patient is prone. Okay. شنو قاعد عندنا الاكزامينشن بعده؟ ها؟ No. Now you need to examine for the ankle instability. Exactly.
Yes.
Ankle instability. For the ankle instability, relax like that, the knee, hold it in this way, and do anterior posterior draw. Okay, for any clicking. Okay. Then for the ankle, you feel for lateral and medial and lateral instability by varus and valgus, looking for the calcaneo, CF, calcaneofibrillar ligament. Tamam? Okay, we're done with that examination part. Then we examined also for the impingement, we examined for the mortar neuroma, we examined for the halus valgus and halus rigidus, and we examined for Bernier fields. Yes. Okay. So
squeeze test for the since molecule if the patient.
yes, we've done it. Okay. So you need to mention it. The best way when you get in order not to forget your examination, لما تجي قريبة منها do it. Okay. ما تخليش special test في الفوت and ankle ولا الريست or hand to the end. لو خليتها to the end, then you will forget. Okay. At the end of the examination, شكرا أخ أمجد جدا على وقتك. Thank you very much. You need to thank the patient, cover him back, and